Good morning, everyone. Ooh. So we want to invite everyone if they want to come have a seat in these chairs. We're, you know, fill it out a little bit. Folks come in still a little bit, so please feel free to come on over. For those who don't know, I am Dr. Leon Maltzby. I am the co-chair of the Black Caucus and want to welcome you all to our World AIDS Day event, Townhall Edition. Give yourself a clap of the hand. Yes, yes. Where two or three may gather, and we have them here in this space. So, first, want to take a moment of silence in commemoration of those who have lost the battle to HIV and AIDS complications, as well as those who are still living and thriving with HIV. So, we can take a moment real quick for that. Okay, thank you. So as you know, this has been a very a trying year for a lot of us that are doing the work and in this fight with HIV and trying to make sure we're providing equitable resources for people in our communities and those that look like us, Black folks. So I'm really excited about this town hall meeting. We've had a lot of good listening sessions, a lot of good work over the last 2 years as a Black Caucus and as a community, and so it's really good to kind of have a space to commemorate that and also get some voices in terms of how do we move this forward. In the effort of time, we'll move this forward and pass this over to Mr. Mario Perez, who is the director of the LA County Department of Public Health Division of HIV and SD programs for some opening remarks.
Thank you, Dr. Malsby. Buenos dias. Good morning, everyone. Want to start by thanking the Commission's Black Caucus for the invitation. Thank you to Don for the ongoing partnership. Glad to be in this space with all of you. So this has been an important week for the global HIV movement because it continues to reveal what the priorities are and are not in our country. So I'm going to start with a question. How do we confront and resist the outright indifference, adversity, and contempt for our communities? So while this morning we focus on the Black community, it's clear that the antagonism towards the trans community, the global immigrant community, Latinos, people from Somalia, is cut from the same cloth as policies that antagonize Black communities. The reduction of the federal workforce, impacting Black women at record numbers. Curbing voting rights will have an impact, particularly in the South. The work requirements for Medicaid coverage, it's clear who the focus of denying healthcare coverage is meant to attack. Redistricting. I mean, who doesn't want Jasmine Felicia Crockett, who represents the 30th district in the White House? I certainly do. But is this a way to take away her voice in Congress? The elimination of SNAP benefits is an assault on poor people in America. Anti-DEI, the oversight of federal grant making to make sure that things are fair, gone. I can go on and on and on. And so these things all play a role in keeping people down. And so another question is, in this increasingly hostile policy landscape and threatened funding landscape, how best do we respond to protect the progress we've made? And how do we make sure that we don't go back to a 1980s HIV response in America? I saw some of you a few days ago at MLK. an event hosted by Dr. Spencer and the team at CDU. Um, and I shared that the progress arc is bending in the wrong direction. And I would repeat some of the things that I noted. So apologies to those who heard this a few days ago. But it's been 44 years since the first cases of HIV were reported at UCLA. And 38 years ago, we had the first ever World AIDS Day, where the global community paused and reflected on the impact of this epidemic. And 34 years ago, the Ryan White program was signed into law, and that poured millions and millions of dollars into communities across the country to help respond to the epidemic and to make sure that life-saving care and treatment services were available. 15 years ago, our esteemed President Barack Obama unveiled the first ever national HIV/AIDS strategy. 6 years ago, the National EHE Initiative and the HIV Epidemic Initiative was launched with laudable goals to be reached 5 years from now by 2030. And progress in America has been slow, but needless to say, we still have 5 years to go to try to meet those 2030 goals. Sadly, we lost Dr. Jordan 2.5 years ago, but before then, 5 years ago, we were able to convene at MLK and celebrate the retirement and life of service for Dr. Jordan. So all positive things, reflecting on the good, the innovation, setting goals in America. But then a year ago, this is where the arc starts to bend, the CDC's Division of HIV Prevention was proposed for elimination by Congress. This year, again, the EHE initiative has been proposed for elimination. This year, for the first time ever, major sections of the Ryan White program have been proposed for elimination. Ryan White parts C's, D, and F. And on Monday, for the first time ever, the White House did not pause, reflect, and join us all to commemorate World AIDS Day. Because it is not a strategy, was a reason. As if a poorly attended military parade in Washington, D.C. is. So let me share a few words about the funding landscape. I'm going to cover a few different buckets because they're all really, really important and they all complement one another. But these are the things we need to remain vigilant on. Medicaid coverage. People need to get it and keep it. There's 26 more days to enroll in Medicaid in California. There's a full court press happening now. We need as many people to be on Medicaid as possible if you are eligible. Because the unpredictability tied to the Ryan White program is clear. Our Department of Health Services, they're seeing about 3,000 fewer Medicaid enrollees each month right now. When we look at DHSP billing, the number of people billed to AOM, Ryan White Support AOM, is going down, which suggests that more people might be in fact enrolling in Medicaid. So we have different metrics that are giving us competing sense of what might be happening. FQHC funding. There are FQHCs in our communities, and I'm not going to name them all, that play a crucial role in healthcare access. Many of them are fighting for their funding lives, and we need Section 330 to continue to allow them to open their doors, but it's becoming a very delicate dance. Ryan White Part A and B, there's some proposed funding shifts. I just drafted a policy statement for the department on how I think we should be thinking about that. In general, I think it's good if Ryan White Part A and B funding follows the client, except If you're going to destabilize Medicaid and Part C and Part D and Part F and FQHCs, then maybe the timing's not the best to begin to shift Ryan White Part A and B money around. We absolutely have to protect the CDC and HIV prevention funding in America. We have to draw that line, and we cannot let them cross that line in the sand. The ADAP rebate fund in California may be our last saving grace. So we need to ramp up the pressure. We need the fund to get repaid by the Department of Finance in Sacramento back to the Office of AIDS. And then we need a very aggressive distribution of those resources into our communities to help preserve the progress we've made and the services we have in place. A few last thoughts. As we think about the progress we've made, particularly in the Black community, we have to reconcile and make sure that the number of people getting screened, diagnosed, and linked to care remains high. But we also have to reconcile that with where people want to access care. Because in our county, we know that over half of the people being diagnosed with HIV are being diagnosed through routine healthcare visits. Yet, where they get their HIV specialty care is often a different place. And so how do we create a more seamless bridge between that diagnosis in an urgent care setting and Bill King's operation in Leimert Park, or Dr. Butler, or with Dr. Spencer, or at St. John's? I can go on and on. We need to change the conversation today with pharma related to biomedical prevention. And our friends from Gilead are in the back of the room. Say hi to them. But I don't think that we will be able to sustain a biomedical prevention response, HIV and STD related, with the resources we have at our disposal now, because they're threatened, they're shrinking, and there's too much need. But we need to figure out how we get pharma to help us support innovation around access, science, how to help us overcome medical mistrust, implicit bias. We need social marketing that knocks it out of the park. We need more navigators than we have now. We need to understand field data tied to biomedical prevention. We need costs to be manageable. We need health plan coverage to not be an issue. There's way too many elements tied to the biomedical HIV prevention portfolio that need more support. And this year's World AIDS Day theme is we have to overcome disruption and transform the AIDS response. So I'm going to go back to routinized testing and its role in our communities versus the preservation and support of specialty clinics. How do we support and undergird them much better? What are the right access points? What is the right provider mix in those clinics? I shared a couple of weeks ago as part of the commission annual meeting a list of priorities. A priority on the top of the list is how do we get people who've been diagnosed with HIV but who are out of care back into care? That intervention alone could have profound effects on the HIV epidemic among Black folks in LA County than any of the other things that we mentioned. And so how do we do that differently? So with that, I'm just gonna share one more thing. I keep on saying that. We are narrowing the gap, not enough, not quickly enough, but the gap between Black men and other men in LA County in terms of rate per 100,000 with HIV is narrowing. What is not narrowing in LA is the gap between Black women and other women in LA County. That gap is expanding. We need to rethink how we are confronting and addressing that troubling trend. I shared some of that data a couple of weeks ago. I think it's very relevant for today's conversation. With that, thank you for allowing me to share some thoughts as part of the opening. Congratulations for the convening. I'm at your service. I do need to go to the NMAC board meeting. I serve on the board of the National Minority AIDS Council, so I'll be leaving a little after 12, but thanks for the invitation.
Thank you, Mario, for those opening remarks. And as we know, it does take a village to do things like this of this nature. So I also want to give a thank you to our sponsors, Board of Supervisor Holly Mitchell's office, third year in a row sponsoring our World AIDS Day event. So we thank you for that, as well as Gilead. Thank you for our sponsorship as well. Don McClendon, commission staff, thank you. Takes a village. Black Caucus, the last couple months of these meetings, really helpful. Our previous Black Caucus co-chairs are in the room as well. Dr. Danielle Campbell and Brother Gerald Garth. Give a round. Yes. And so again, this is a town hall, so a lot of things are coming up. The idea is to have some conversations about that, which would be facilitated through open dialogue by Dr. Dante Morrison. Before that, though, as things are coming up, have the questions in mind, write it down, so when we get to that point, you can make sure you have some healthy discussion about that. As we know, we've seen over the last couple of 12 months now at this point, how people living with HIV have been impacted, and also from a prevention landscape as well, through clinical as well as research measures. And we know we wouldn't have the advances of medicine if it wasn't for research. So research impacts how the clinics work and operate and things of that nature, and how patient care looks. And so we're really excited to have Dr. Leo Moore, medical director with the LA County Department of Public Health, as well as Dr. Nina Harara, coming up here to talk about the intersection of clinical research and insights about the threats on facing Black sexual health. So I bring you now Dr. Harara and Dr. Moore.
I don't think it's is it working now? Wonderful. They said we should have a discussion, so we're going to sit down and have a bit of a discussion.
Oh, perfect. Yeah.
I'll just say a little bit more about myself as we pull up the slides, which I think we're switching out.
Yep.
My name is Nina Harawa. I am a professor both at Charles Drew University and at UCLA in the Department of Medicine. I am an epidemiologist, and I've done research in the community for years. I want to say it's so good to be here. When I got asked, I was like, I don't have time for this. I can't be there. And then I thought back at how many of these rooms I've been in and how many different coalitions and efforts that I've been in specifically to address HIV in the community and in the Black community. And I had to say to myself, after like the isolation of COVID and the busyness and all the things, are you going to miss an opportunity to be there with your people thinking through these issues? And I was like, no, I can't. So I'm really glad to be here and to be here with a close colleague and friend, Dr. Moore. Do you want to say anything?
Yes. Good morning, everyone. Feels so good to be here with everyone. A little bit about me. I'm Dr. Leo Moore. I'm an internal medicine, HIV medicine, and lifestyle medicine physician, and serve as one of the medical directors for LA County Department of Public Health, overseeing 3 of our clinics in central LA. And it really is always a pleasure to be here among community, and also to be sharing space with Dr. Harawa. So for the last 11 years I've lived in LA, and Dr. Harawa is one of the first researchers and colleagues and friends that I met here. And so it's an honor to be sharing this space with you.
So can we switch to the first slide? This has a list of some questions that we were asked to think about. What are we seeing right now in our work in terms of the implications of all the changes and the assaults at the federal level? What are the indicators that worry us most? And then how can we prepare ourselves in our different roles? And so I think we'll each do some reflection on this. If we could just go to the next slide. And I just wanted to talk first a little bit about feelings, because, I mean, the assaults that Mario described that you all are seeing are so important, but it's also important to check in and recognize just how that affects us in our day-to-day life. And it was also part of why I recognized why I needed to be here, because these things sort of soothe my spirit that's stressed out and worried about all this and often feels. And so I'll just list off some of the things I feel like that I'm feeling and that I hear from other colleagues who are researchers. I think we feel a lot of sense of fear, of course, fear for our positions, fear for the future of our field, like the paths we were on and going for that goal. We can't even, we don't even know if it's there anymore to reach for. We feel a sense of powerlessness. There's so many of the problems that are happening that's really hard to know. Even though I feel blessed in terms of education, resources, position, it's still hard to know, can I actually make a difference? Where can I help? Feel the sense of betrayal sometimes by our institutions. You know, we have institutions that were very quick to change the names to get rid of these initiatives that they had been doing around promoting equality and all these things that they said were important. Sometimes they're not, they're moving away. Often they're saying we're changing the wording, but we're still going to do it. But it's hard to really know whether to trust that. And then that also creates this other sense of like, who can we trust? And so I think that's among the many things that I'm feeling. Do you want to speak to that as a provider?
Yes, I think one of the things I continue to feel is our focus shifting, particularly when we think about the services that we provide being safety net services and being so vital, when there are even rumblings of conversations of clinics closing or of services closing. It definitely calls into question, is our mission creeping? Is our mission changing? And so that's one thing I definitely had been feeling. But I also have been feeling like we're in a moment where even when things are difficult, that we have each other, like that we have this community, and this community that for many of us, this work that we do is a calling. You know, it's work that we feel that we have been meant to do for all of these years. So a big part of what I've been thinking about and even preparing for this conversation is like, how do we pull together with whatever the resources will be? I appreciate Mario laying out, you know, what we are potentially facing. How do we plan for what we are facing together? How do we think about braiding the services that we have, for example? So many of these thoughts that are coming to my mind about the opportunity that we have in this moment, because this calling that we all have and this work that we're doing can't stop, and we can't afford to go back.
Yeah. And I feel that calling thing really strongly. I have a couple of colleagues who've gone on to other positions, not exactly because they wanted to, but it seemed like more of a sure thing. And sometimes I think, should I be planning to do something else? And I'm like, well, I thought this is what I was supposed to do last year. I don't, nobody, God, no, Spirit has not told me this, I'm supposed to do something else. So I'm going to trust, even though those targets and everything seems murky, I'm going to trust and stay on this path. Um, and we all have our own choices around those things. I'm not trying to criticize anybody else, but I wanted to echo your point about the vocation. I think you had a grounding exercise for us.
Yes, and so I have a grounding exercise to share with everyone, and it really focuses on the power of community. So wherever you are in the room, place your feet on the ground, close your eyes or soften your gaze, and take one slow, deep breath in and out. Think of one person who has shaped your understanding of community, justice, or compassion. It could be someone you've worked with, someone you've cared for, a family member, a mentor, a friend, or even someone whose story stayed with you. Imagine that person standing behind you, reminding you why you show up in the ways you do. Now think of someone standing alongside you, someone who walks with you in this work, or someone who encourages you, supports you, or inspires you to care more deeply. And finally, think of someone who will come after us, someone whose life will be better, safer, or healthier because of the collective efforts of advocates, providers, community members, researchers, storytellers, and allies in spaces like this one. Feel that lineage, past, present, and future, supporting you, reminding you that each of us has a role in creating a world where people living with and impacted by HIV can thrive and where stigma does not decide outcomes. Take one more breath, in and out, and reopen your eyes or focus your gaze. Thank you, and Ashe.
So, in thinking about what we're seeing in our realms and what worries us the most, when I got asked that question, it called to mind some other work that we're doing in terms of really of working to document the impact on the workforce. Myself and some colleagues at UCLA at the California HIV/AIDS Policy Research Center have wanted to make sure that those stories don't get untold. And so we are doing some research on that, but we also have a video that we want to share with you from that. And you'll see a video of somebody many of you know, Robin, and she's talking about the impact of some of the cuts.
My
in
name
terms
is
of her
Robin
life.
Barkins. I am a woman that has been living with HIV for the past 25 years. I've been working in the public health sector for the past 7 years around people living with HIV, individuals experiencing homelessness, and formerly incarcerated individuals. So what really made me get into this work and inspired me to get into this work, while I was incarcerated, I met some women that were living with HIV that came into the jail to educate women about self-esteem and how to just thrive and live with HIV and cultivate healthy relationships. So upon my release into treatment, it kind of inspired me to get to know more about HIV and how to become an advocate into the HIV space. I was a peer educator and a peer navigator for people who were diagnosed with HIV, who have been out of care or living in isolation. I lost my job due to budget cuts. At the time, my employer just told us we're not renewing the grant. Basically, we don't know where our other means of funding will come from, and we basically wish you all the best. That left me in a dark place. I was just recently grieving my sister that passed away a few months prior to that. We had to bury my sister. So I was still struggling with grief, and then the grief of my mother spiraling down with the dementia. And then the loss of my job on top of that, it took me to a really, really dark place of depression and alcoholism. Since I lost my job, personally, it affected me in ways to where I engaged in a little more alcohol use. I was isolated, deeply depressed. I had thoughts of suicide. And it left me, emotionally, spiritually, and financially bankrupt. We had built relationships with these women that depended on us for our emotional support, our peer support, accompaniment to doctor's appointments, to just help them navigate social services. And by us not being there, some women fell out of care and stopped showing up to different community engagements. Women who are diagnosed with HIV like myself, when the budget cuts came, I was skipping dosages in fear of me not having enough medication. So I told my doctor that if you see any changes in my labs, just know I'm skipping medicines, dosages weeks at a time, so I can stretch out my meds. So it was just fear of losing medications. Some people thought they were going to die, they wasn't going to make it. It was just everybody was in survival mode, including myself. Even the organizations went into survival mode, that they couldn't provide the normal services or the collaborative partnerships like we're used to. And we missed out on a lot of fellowshipping, I would say, when it was time for us to come together for different events and activities. I'm still searching for employment. These terminations has really still have been a barrier to my employment. So I kind of like tried to pivot and go into the reentry space, but still try to um, connect the reentry and the public health space together to try to still give hope to HIV and prevention, and for women that may be exiting state prison that are living with HIV. But it has been hard for myself to find employment, even try to sustain myself. And one of the things that affected me during the termination period was just for like a simple peer education program. They're requiring you to have a bachelor's degree, something that a person with lived experience like myself. I've been living with HIV for 25 years. I mean, I feel like with a peer specialist program, my peers will want to listen to me versus somebody just with a bachelor's degree that has no lived experience. So I think that has been really a tremendous barrier to employment as well. My hopes for the next steps and what will happen next is that we can um, reinstate our funding, open up more job opportunities for individuals such as myself and my peers, and we can be able to rebuild and gather again and in this space. My fears into what will happen next is
So I want to just really thank Robin and all of the people who are willing to share their stories with us. We have, there were 6 or 7 altogether, and I'll share with you at the end the website. But we feel like the stuff that's happening on the federal level, they want us to forget the human stories. They want us to these to just be numbers or arbitrary, or maybe the belief that, oh, these are just workers who are sitting on their butts not doing anything, being wasteful. They don't want us to know these stories, so it's important that we hear them. But I also want us to all raise up Robin in particular in prayer today. She had intended to be here, but she experienced another loss in her family. So we really just have her, I have her in my thoughts and prayers, and I hope other people will send out that energy for her today. But do you want to talk about what you're seeing in terms of patients and?
Yes, yes. So a few things that I'm seeing in clinic, and I also reached out to a few of our nurse practitioners and physicians in our clinics as well regarding some of the things that they're seeing. And I will say before I even share the things that many of them are things that have been issues for many years. So these are not going to be new to you, but they are still worrisome and concerning. One is that we are seeing increases in awareness of PrEP over the years, but we continue to see the gap when it comes to getting Black people on PrEP and getting them into those services. And with us seeing that there are going to be less resources, that is a major concern, and that we could see it more decrease, actually, the gap continuing to widen, if you will, for access to PrEP. So that's one. Another that we're seeing is a lot of repeat sexually transmitted infections because partners are not being treated. And we're seeing quite a few people who are being lost to follow-up as well, not coming back in for treatment as well after being tested due to issues around homelessness, food insecurity, and lack of phone or working phone. And so a lot of the things that we're seeing, as I mentioned, are things that we've been seeing for a long time, but with less resources, we're particularly concerned that it will only worsen. The last thing that I'll mention is with the repeat STIs I mentioned, particularly we're concerned about the syphilis rates in LA County among Black and Latina folks, and this concern that we can see an increase in congenital syphilis cases as well. And, when we think about Black syphilis cases, Black people make up 8% of the LA County population, but almost 20% of the syphilis cases in LA County. So it's another area that I'm particularly concerned about and wanting to think through solutions with this group and everyone.
And then I'll just add to that the general fears that are making it harder for us to think about how do we do research because people are afraid to be. Why are you asking me these questions? Why do you want to know if I want to be in a study? What do you mean you want me to share data? Or even being much more careful about the types of questions we ask of people. And then we have odd restrictions. So like I'm part of a federal grant where we have to share some of our data, and we've actually been told we can't ask about people's gender identity. And so, we're going to ask those questions, but we have to like hide that we're asking them. And some of the ways that we've been told to ask questions related are not the way we would do it, or not the most culturally sensitive way. So just even being able to continue to do the work when you actually have the funding. Of course, lots of people have lost funding, lost staff, et cetera. I have partners that are losing staff and closing sites, et cetera. But even when you do have the resource to do the work, the public has a lot more reason to be suspicious as to why you're doing the work or what the implications of it will be. I think we'll go to the next slide. Another thing that we were asked was to just think about for people who are in the community and really want to understand what's happening, the degree of it, what are the implications, or like what might be coming down, what are some resources for thinking about those data? And there are a lot of good resources out there. So I just wanted to share some data sets that are available. There are several policy trackers that I think are really helpful that you can click on and see like what policies are either being looked at or have been passed related to reproductive rights, related to LGBTQIA people. There's one specific to trans individuals. And then the middle two sites that you see on there, the first one's for the HIV/AIDS Policy Research Centers that I told you about. We have many policy briefs that we put out, but we also have a California-specific policy tracker. So you can see Assembly and Senate bills that are either being discussed or have been passed, et cetera. And then AIDS View is great for seeing by locality and by different group, different metrics related to both people diagnosed with HIV as well as prevention and PrEP uptake. If you go to the next slide, I just have a couple more examples. This is just a view of the ACLU tracker for anti-LGBTQIA legislation. And then the next slide shows you some other resources that are broader, looking at human rights, civil rights, healthcare. And I think it's important that we don't forget that what we're seeing is an attack on human rights, right? When you get to the core of all of it, it's an attack on human rights. And that we have to keep that broad perspective as well as our more focused perspective on health and HIV in mind as we look to the future. I think we can go to the next slide. So this goes to the big question: how do we prepare? And I'd love your thoughts on this. I just give him the hard questions.
So one of the ways that we prepare is remembering that listening is free. So, listening to our patients, listening to the people that we serve, listening to other community members so that we can really think about how to utilize the resources we have as effectively as possible. So a few examples I think of in the clinical setting, for example, converting from appointment-based to drop-in centers to create more flexibility. Shifting hours to accommodate work schedules, offering phone, chat, or text-based visits as well. Also really thinking about increased partnership between our organizations. With the limited funding, are there opportunities for HIV organizations to collaborate to emphasize their strengths and expand their reach? So how can we braid our services across organizations to fill in the gaps that decreased funding will create? So how do we become, for example, the LA County Sexual Health Network, where there's no wrong door to services because we refer to each other readily based on the services needed? including hospitals, DPSS, and other programs addressing the social determinants of health. And I think, the commission is one of the best places to have these conversations, to brainstorm together, to plan on how we can strengthen our networks and bridge those gaps. Another thing that we really should keep in mind is to remember to put on your oxygen mask before helping others. So, as has been echoed and shown, and we saw in Robin's story, which I too will keep her in my prayers, that it's no secret that the HIV workforce is diminishing. And during this time, it's critical that we check in with ourselves regularly and that we check in with each other.
Yeah, I don't think I can't emphasize enough that we kind of inevitably we think about our own agencies or our own roles first, but I don't think our communities can afford for us to be that narrow-minded. We have to keep that bigger picture in mind. What is the best thing for the community? What is the most efficient way we can use the limited resources we have, even if it may mean losing a patient that you want to add to your count or something like that, because the resources have gotten so small and the threats are so big. I've also wondered too about like clinic hours. If there were more hours at night, would people who are with what's the word for people who are undocumented maybe would feel more comfortable, because I don't see ICE agents out at night. At least the videos I see, it seems like they work 9 to 5s, and so maybe our community would feel more comfortable coming at different times of the day. I think these are questions we need to ask.
I mean, the other thing that I'm thinking about is more mail-in kits being, ensuring that people can receive services in their homes as well. I recognize the kits are quite expensive, but even thinking about some of the legislation that came through California a few years ago, really pushing for us to be able to bill for those kits as well, so that, we're able to provide them to more folks who are, fearful of leaving their homes.
And I just want to remind people that, in many ways, I'm less worried about the HIV community than some other, sort of health topics that have been under attack, because this is a community that, the good thing about the 80s, when you say not going back to the 80s style, is that in the 80s, people did a lot with very little, and people did a lot with a president who didn't care, and et cetera, et cetera. So I do think we have that strength and that example to build on, that some groups who do research in certain areas are probably floundering a little bit more than we are. And then as a Black community, we've been through a lot, and we've figured out how to do it and how to survive and thrive in many cases. So that also gives me hope. And we'll go to the next couple slides, and I realize we might be at our time. So I always love this idea of that, that the Japanese symbol for crisis also has opportunity within it. So I think it's important to think about what are the opportunities that are being presented now. And I heard Dr. Moore talk about some of those. And if we go to the next slide, there's many different things that I've been thinking about. And one of them I think is new coalitions. I'm seeing, at least in many settings, I feel like there are increased coalitions being built between Black and Latino communities because of the ICE raids. I've seen some great things that Scope LA and Community Coalition have done, really bringing those communities together to say, ICE out of South LA, or how are we going to combat this? I loved it when I saw the mayor of Chicago refused to answer a question because they called people illegal aliens, and talked about how that, how Black people were called slaves, and that he was just not going to talk about human beings that way. And so I feel that these coalitions, they are needed, and that can be our strength if we can continue to build on them. Because reproductive health is also under threat, if we could think about opportunities to better sort of integrate that with sexual health, because in many ways they've still been separate realms. I mean, this is an opportunity, I think, to do that in new ways. And then I'll just say something about the last one, because I know I put a lot on there, which is one of the groups that I still see has a lot of power and has been successful lately are unions, and we've seen some amazing wins with unions. And I've also seen this very much at UCLA. We got our grants back because of coalitions with the AAUP, which is not a real union, but a faculty union, and they've been working a lot with UAW and really recognizing there is that power with labor. And I think that's another sort of coalition and thing that we really need to recognize, that historically has been a strength, and there may be new opportunities there. So I don't know if we should if you want to add to that, and then we should open up, or where we are at, because we're all way off time anyway, but you can, do you want to add a little bit? And then...
So, I mean, I'll just end with my favorite African proverb. If you want to go fast, go alone. If you want to go far, go together. Thank you.
One or two? Move with some haste, Dominic.
Hi, happy holidays, everyone. I was curious to know, how are we using the American Medical Association to advance awareness of HIV and PrEP in other medicine realms where these conversations typically don't happen?
That's a great question. While I can't speak for AMA, I feel like what I've noticed AMA, ACP, and a lot of the organizations having to tackle right now is truly around vaccinations. And, that's because we know that vaccinations have been under attack. I will say that during World AIDS Day on December 1st, I saw a lot of organizations, not only medical associations, but, all types of organizations talking about World AIDS Day, talking about HIV prevention. I mean, if you're on Instagram or the Gram, I even saw the Shade Room post about World AIDS Day, and they posted some facts as well about PrEP and about HIV prevention. So I think, in addition to medical associations, we really need to ensure that our partners are giving factual information and are there to meet people where they are as well.
And I just want to recognize that the NMA, the National Medical Association, was the Black Doctors Organization, has been really active in this, and in part under the influence of people like Dr. Jordan and Dr. Spencer, and so they've been really active. I'm just not as aware of what the AMA is doing. Where I think we also need to push probably both organizations is also towards more is universal health care, and sadly the AMA in the past has stood against universal health care and single payer. They're moving more in that direction, but unfortunately some of these organizations have been sometimes more about the profession than about the health and the health care, which needs to be the priority.
Any other question? All right. Thank you, Dr. Moore. Dr. Harrar. Okay, I prefer this. Again, give it up again for Dr. Moore and Dr. Harrar for that. Oh, I'm gonna need for Roxanne. I'm gonna need one. Oh, you're gonna do more? Yeah. All right. And so to ground us as well, the Black Caucus over the last couple of years, we've done a few different things. One was an organizational needs assessment with Black-led and Black-serving agencies in LA County, with the hope that we can kind of identify what their barriers were, what their experience was with getting funding, and how we can better enable other agencies besides the ones we all know get funding to be funded to do the work outside of the traditional ones. We also did listening sessions. We did 6 listening sessions, which we'll get into some of the data from those listening sessions and kind of what came from those sessions, very rich and fruitful. And what this data kind of shows and lays a framework is basically of the Black sexual health experience in LA County from a individual experience, from participants and patients and community, as well as from organizations as well. I'm also joined here with Roxanne Lewis, who will be co-leading this with me as well. So while we did it so natural, as we know, as Dr. Moore mentioned, listening is free. Listening is very free, so we have to make sure we create space to hear the people and what they're going through. And so we had to make sure that one of the spaces were rooted in real lived experiences and understanding the real barriers people are facing from a Black sexual health lens. We also want to make sure we can see from the participants what was working, what wasn't working. And if you're working in a community, people be very vocal about what's not working. Very, very quick to share their experience and their dislike for certain things. And that's really valuable because now it allows you to get opportunity to kind of how do we rework something and how do we build those coalitions and/or bridges to make sure people get the services they need in the capacity they can get it. We also were able to kind of create a safe space. That was one of the biggest things, of making sure people felt safe in those different spaces to share their experience. And so that's why we had different subgroups of people, again, 6 of them, which we'll get into later. People with a trans experience, same gender loving men, cisgender women, non-US born immigrant communities, and faith-based community. I may have missed one, but we'll get into it later. Oh, sorry.
He said what I was going to say. So, yes, as he said, back in July 2025, we held a listening session for Black transgender community members. In May, we had for non-traditional providers, so that included not your traditional medical providers. So there was a listening session for those individuals. We also had a listening session that included Black-led and Black-serving organizations to determine what needs those organizations had, because they may be different than some of the larger specifically Black-led organizations. And then some of our prior sessions that we initiated in 2024 included faith-based. That was done with folks from the religious community, so working with folks that were in the churches, a women's listening session, which was really great, same gender loving men, immigrant communities, and then we've still been working on completing our youth and non-MSM Black men listening sessions, so those are still in progress. It was really important for us to talk to you guys today about some of the themes that came out of those sessions. And so we know that out of a couple of the sessions specifically, they talked to us about the navigation pathways being unclear or inaccessible, meaning it was difficult for them to be able to navigate services. We all know what it's like to get to a location and have a hard time trying to figure out who we're supposed to talk to. So when we are thinking about folks who might have less capacity than us, these are some things that come up. And so as providers, these are things that we really need to, especially right now with services being under fire, to really hone in on when we have people coming through the doors to make sure that the pathways for them to obtain services are clear. They also noted that trusted messengers need support. So these are folks like our peer navigators, some of the community leaders that are working with our folks. They need support. And we've heard this in some of those listening sessions. Whether it's gift cards for incentives for them doing this work, or a pathway to leadership roles or employment roles, these are the things that they would like to see. They also noted that cultural humility was not standard across systems. So you have maybe a provider who attended the training and they're really good at it, but then you have maybe front desk staff or security staff who are not as well versed and outright rude in times to our patients and clients. And then also funding instability that's threatening trust and progress. So as we heard earlier, sometimes folks are saying, hey, well, we heard that the funding wasn't going to be there, so I'm probably not going to show up. Or maybe I'm going to ration out my meds because if I go there, they're going to tell me that the services are not available. And then specific to the Black transgender listening session, they talked specifically to us about navigating anti-Blackness and transphobia. Um, I was reading a report recently that came from, I think, the LA County. I think it was one of the board. I think it was the board of supervisors. They were talking about the number of cases of violent crimes against Black transgenders, and it's staggering today. So this is definitely a really hot point. But specifically, we were looking at things that came out of this listening session, like misgendering and lack of affirming care. Um, we've got great clinics in LA County, and great service providers, but we really need to hone in on this. And then a need for a Black trans-led wellness hub. And then lastly, cuts disproportionately harming trans affirming services.
So as Roxanne mentioned, I think it was earlier this year, Dr. King and Dr. Spencer facilitated the non-traditional provider listening session, was really valuable. And what we saw was, again, a common thread between all the listening sessions where there's a need and desire to learn more. And so because they don't necessarily interface with HIV patients every single day, they welcome the wealth of information they got from Dr. Spencer and Dr. King about how they can do that. And now they also have a resource, so when they do have patients who are coming through either housing programs or their clinics, they now know who they can reach out to kind of get more information about how to treat that patient in a more appropriate way than they had before. That led into, again, before, on the listening sessions for the Black-led organizations, just for context, was before this year. So naturally, before we had all these different, funding cuts and fights on everything, it was really more so how do we build partners outside of the traditional spaces. And so there was a survey that was done with Equity and Impact Solutions and interviews that were done through that group as well. And these are some of the things I talked about and we'll go into further. But some of the overall thing is underfunding and overstretched. There were some barriers to contracting in the RFP process. And so typically if you didn't have certain funds, it's very difficult to get the contract because you had to put certain things up front and or pay first and then get reimbursed later. And not every agency, depends on the funding, can do that. So that's a very real thing. And infrastructure gaps. And so not every nonprofit or CBO is very large to where they can have a team that does certain things like contracts and grants and things of that nature. And not just we know, and as we saw this year, cuts threaten survival. So there's been certain people we've heard today that had to shut down different departments or lay off certain staff. It's been all across the board. So as a conglomerate, that's a big issue, but also as a smaller CBO, it's even more major issue because that could be life or death for them. And so some of the largest agencies favored in terms of public funding, and so they wanted, really, how do we diversify funding was the biggest common conversation we had through the organizational needs assessment. And so they knew that larger agencies had the funds, but also even those agencies still wanted public funding, so they weren't so tied to the federal dollars as we're seeing now. A need for infrastructure funding and not short-term programs. Some gave the idea of how do we, I forget the exact term they use, but how do they get basically a micro loan, if you will, from a funder just to kind of get some of these things in place to allow them to basically get a running start to be able to support funding and the grants that they were to get some. As we know, cuts destabilize the prevention and care ecosystems, and there's a real desire for authentic partnership. So the community and providers shared the following. Again, safety and cultural responsiveness, clear pathways to care. So I think what we're seeing is nothing new. So as you're reading these different things, there's nothing new that we don't already know. I think what's even more frightening is that this was even before this current administration and funding cuts, so it's even more pressing now as we're facing the different things in this climate. So as again, what's at risk? So as we know, mentioned earlier, jobs, prevention, outreach linkage, trans affirming programs, and again, I think one of the things I got from some of the listening sessions, especially the trans listening session, was like, it's a very sacred space, even beyond just the HIV piece, but just more so as a trans person. And so when you don't have, the right funding, things of that nature, you don't have the time and money to educate yourself on how to really treat patients. And so, for some people, it might be a smaller thing, but other people, like we saw in these listening sessions, it's a really major thing where funding needs to be put in those training dollars to really hold people accountable, which we saw is not happening. Community trust and continuity. So again, people know there's certain places you get certain funding from, or certain resources, whether it be housing or gift cards or patient navigation. And so if those things start going away, they no longer have that advocate and/or resource or service to go to. So then they're left without anything. And I would say our charge today, so center Black voices, as we know, being able to hear them and use their lived experiences to advocate to local officials and those who have the power to make decisions and or give up funding is really critical. So it's not just a data point, but you're actually telling a lived story. Being able to protect and expand funding. So again, reaching outside. We had a panel, I think, earlier this year at a NASM conference, and there was a conversation about how do you get grants outside of traditional HIV funding to then use that for the patients we're working with? How do we think outside the box of the same grants we're all applying for? Invest in Black-led organizations from top to bottom, so making sure that's Black-led and Black-serving, and making sure the staff there is educated because, just because we're working with our own community doesn't necessarily mean we're always doing the right things for our community. It's always growing, always evolving, and how do we make sure that we're meeting the need for our own people in an authentic way. And build actionable recommendations, and that's kind of what we want to do today in this listening session, town hall, if you will. It's a way to get some voices and ideas and how we can give it back to the people who are doing the work, people who are making decisions, whether it be funders, whether it be pharmaceutical companies, whether it be advocates, patients, all the above, Commission, Black Caucus. How do we galvanize these thoughts and experiences to actionable items? I think that's it. Yes. So now we're going to turn it over to Dr. Dante Morrison, who led quite a few of our listening sessions. Give a round of applause for Dr. Morrison, who was going to support and kind of get some ideas and get some things on paper and be a thought partner.
Listen, I know y'all hungry, so we gonna zip on through this part. I'm just kidding. But who is hungry? By a round of applause. See there? So a lot has been said this morning, and I want to ask a question really quick. Who in the room right now is community? Meaning you do not work for an HIV service organization. You do not work in research. You are pure D community. Hold your hands up high so we can just see. 1, 2, Tracy, put your hand down. 1, 2, 3, 4, 5, 6. Okay. So we have 6 people out of 7 people out of an auditorium filled with individuals, and oftentimes it can feel like we're preaching to the choir. So I want to give space first for the community to speak up, because those of us who've been doing this for decades, we really kind of already have an idea of where some of the gaps are. But I really want to hear from those who this is like, a lot of this is foreign information. This is new. It's like, wow, this is interesting. So what resonated most with you about what you heard on this morning? Those of you who are from community. Oh, all the way in the back? Run, Dr. Mosby. Go, Dr. Mosby.
What resonated with me was that I didn't realize how many women have HIV. It really shocked me as a woman and as an older woman to see that and know that I'm a teacher and I deal with I teach cosmetology and I deal with a lot of women, especially in cosmetology. And it never dawned on me to actually talk to them about protection and about even the young girls that I see that, are actively sexual, to even talk to them about, hey, there is a high rate of women that have AIDS, that we're getting them. It shocked me.
Thank you for sharing that. I appreciate that. Thank you. And just follow-up question for you. Do you now know what steps to take to ensure that you can access that information and refer those young women to get services?
Half and half. I do teach a course in for cosmetology. We're mandatory to teach a course in health and safety, and in health and safety, I have to teach all the bloodborne pathogens. So I do know about all the bloodborne pathogens and how to teach them, and I teach them about AIDS and HIV and how it is, and the understanding of what like what is autoimmune system and how do you get it and how it's like a triple negative. So I know how to teach that, but I've never had the resources to even lead them to where to go. And I teach that class like once a month.
Awesome. Thank you. Thank you. So those of us that work in the field, please make sure that we go in back there to give our service, our support, and let you know how we can help you to just elevate in that area because it's definitely a need. Any other person from the community? Yes, ma'am.
I'm actually a registered nurse, but I wasn't aware that there's an increase of syphilis. This is absolutely disgraceful.
I agree. Did you all hear what she said? She said that she's a registered nurse, but she had no idea that the syphilis rates were high. If you listen to Dr. Moore, he shared about how the rates of syphilis are elevating, they're skyrocketing, and specifically in Los Angeles County. She said no one is talking about it. Hold on, Dr. Moore, why is no one talking about that?
Well, so I mean, I will say, you're saying why is no one talking about syphilis? Mm. Well, one of the issues is there's not nearly as much funding devoted to sexually transmitted infections outside of HIV. So that's kind of one reason. Two, even when I think about in the media, there is more of a focus, I think, also on HIV because sadly HIV can also be villainized. There's a way that HIV can be used even in storylines as a way to draw people's attention in a way that that STIs are less likely to be used. But I think also many of the campaigns I will say that I've seen around syphilis, like we did a big campaign a few years ago with our Division of HIV and STD programs. Is that campaign still running, Julie? Not sure. The campaign. So there was a campaign that really was focused around congenital syphilis and also around informing women about syphilis as well. So I will say here in LA County we have tried to do our work around putting out the message around syphilis, but I definitely don't see at the national level that there are a lot of big campaigns, nor am I seeing it talked about in mainstream media, which is where a lot of people get their information.
Thank you. Any other community questions? Oh, Dr. Mosby?
My name's Dawn Howard. I work with Dr. William King. I'm his special projects manager. And first of all, I almost fell out the chair after Dr. Perez's presentation this morning, because even though you hear about all the cuts, you don't know all of the domino effect of everything. And what I was going to say was your I was just going to say, if we go after the DEI companies, they already are on board. I'm sorry, yeah, the DEI companies are on board, and that might be an easier way to get funding. Also, there are a lot of wealthy patients that have survived and are thriving. And maybe we need to start doing a personal appeal. If your government's not going to do it, why don't you give back? That's just an approach. Okay?
Thank you. And that definitely is an excellent segue into the next question. We talk about the impact of cuts on Black sexual health. And just general question, how have you or your community already felt the impact of reduced HIV prevention, care, or support services? So how have you already felt the impact? Yes, ma'am. One sec for the microphone. We want to get it recorded.
just watching the premiums for us go up. Okay, I mean, zero forever, and now all of a sudden they're expecting you to pay $100 a month on what you don't already have. Most of us don't work, so now there's a hustle like, okay, what am I going to do? It's going to have to be just community, helping community. Okay, and then I'm disturbed that at the education it just is not there. Just not there. Not to help the kids, not to help the older people, nothing. So for me, it's just going to take each of us that know, get somebody that doesn't know, and make it work, because help ain't coming.
And based upon what you're saying about we have to help each other, just to add to that as a question, what obstacles are you seeing as it pertains to us providing those services within the community? Like, there are a lot of health educators in here, but there are also gatekeepers that don't allow us access to come into the communities to provide those services. How can we eradicate that? How can we overcome that obstacle from a community perspective? What would you like to see happen to ensure that you're getting the education and the navigation that you need? She said we may have to go underground.
We may have to go underground. I mean, nobody's going to help us do it, okay? So for me, and just in my community, we kind of meet, and because I'm infected, I get to talk to people who aren't infected to try to keep them from being infected. Know to tell them where they can go to get information, because I know where to go. It's huge. But I think if everybody just decides, okay, I'm going to do this and make this work where I am, and then hopefully it'll just kind of fan out so other people can get information, because people are so ignorant to so much stuff. And this new syphilis, let's just talk about it. It's new and improved. Multiple therapies, all kind of stuff. It's a scary situation. So in that, I have to be diligent and do my responsibility when I see things, speak up, speak out. That's all I can do.
So basically, just to summarize that, more lived experience stories, kind of what Dr. Harawa shared with the video of Robin Barkins, lived experience. Now, how do you feel that is HIV conversations normalized within communities of color? No. Who feels that it is normalized, that most people know about HIV? No. Okay, so we're about, I see your hand. So we're about, what, 40 years into the virus, and there is still a gap in education and information. And you said that we need to start having more basically grassroots conversations about sexual health from a real life perspective. We're talking the language that our neighbor, brother, sister understands. Okay, so is that's safe to say? Okay, so why is it taking so long for those conversations to begin? Why are we still here? Yes, ma'am. Oh, she done moved to the front. She in the meeting now.
You know, as a business owner, what I like to say is this. No one wants to do anything for free, first of all, and that's the problem. And I like volunteer work. And I think that the best way to get this out to people and people in our community is I will offer a business boot camp free for any businesses. We pull in these business owners, and we, in that boot camp of giving them how to do their finances for free, we talk to them about educating them about this and about the community. And once you get the business owners on board, because those are our people, it just hit me when I was sitting back there that back in the day, how did we get the word out? Through the salons, because I'm a stylist. Barber shops, beauty shops, we talk to people. So the only way we can get this out is that we have to give something to get something. So to give something, we need to give the business owners something for free that they desperately need, and then we have them get the word out, have them post signs out in their businesses, have them talk to people, and that could be a requirement for them to be able to get the services that we're going to give them for free.
Do that make sense?
Okay, I got that. Anybody else want to add to that? How can we create that kind of change?
I'm Jerome Woods, the founding director for the Black LGBT Project. I think one thing we can do is establish a particular network where people can go to. They can share information and collect information. We talk about, for instance, the Black LGBT Network, but where is it, who is it, and how is it established? How do you get to it? And I think it's the same thing when it comes to AIDS and HIV. I've seen sort of in silos where the barbershop over by APLA, they have conversation about AIDS and HIV. We used to know about Boulevard Cafe here in Los Angeles. We talked about the barbershops and beauty shops where people disseminated information and went and they played chess, but they talked and discussed. I'm seeing more with the younger people, spades and bid whists, and where you get a chance to socialize and share information about what's happening with you and your peers. I think part of it too is finding a place and an opportunity to share the history. So some people, the people where they're programming for 18 to 29 or 18 to 35, they see what AIDS and HIV look like. They see some of the struggle. They see the body changing, the color changing of the skin, the hair texture changing. They don't realize what it is. We talk about doxy PEP and all of those other things, and it seems so easy to be cared for, but we still have the shame, we still have the stigma. We have peer counseling that won't take place because someone knows somebody else. I've seen people that would go to a hospital going for their treatment, and they hear a voice that sounds like their neighbors, and they won't go in. On the other hand, I know Holman Church is doing things, Trinity Baptist Church, the barbershop conversations are going on. There are many things happening. In the meantime, in other organizations, Charles Drew, people are talking about it. But I think, again, too, we're missing out on the convalescent places and places where people are still having sex in older communities where people have to, because of economics, live together and share together, and some younger people are having sex with older people. So we're seeing all of that needing to be done. Also, lastly, I'm sorry, but I think there should be something done like an ambassador sort of connection or committee to the workplace, not just in the barbershop and some other places, but where you go and talk about it, and in the arts community, dance for HIV/AIDS or that's one thing. But there was a booklet at one time that talked about AIDS in the workplace, whether you're a performing artist, whether you had a business, you're a CEO, and I think that needs to come back again.
Thank you, Jerome. I appreciate that. Thank you for both of your comments. Well, everyone's commented so far. I think all of that are great things we can implement in community that will normalize conversations, that will eradicate a lot of the stigma and shame that we still see when it comes to talking about not only HIV, but sexual health. Some people are just scared to talk about sex as if it's not happening right now somewhere in the world. We don't talk about it. But since we have some high-level officials in the room, what should LA County county leadership and elected officials be prioritizing in this moment to protect Black sexual health? Let's just say you had all of them lined up right here, and you can just say, listen, I need you to talk about this as it pertains to Black sexual health. I need you to add this to your agenda items. I need this to be a heightened topic of discussion. What would you say to them? Yes. Hold on.
Hi everyone, I am Nancy from Chirp Los Angeles, and I work at a nonprofit, and we work with anyone who's HIV positive and connect them to housing and supportive services. What we've encountered, and I think it's what's missing with HOPWA, is families. HOPWA, housing opportunities for people living with AIDS or HIV. Yes, so that's who federally funds us, and families who are living with HIV. I think we're only focusing on men and men having sex with men, but not with families. So that's what I'm missing. And then I'm also encountering fear in our clients because of instability. They get Section 8 vouchers through the pauper program, so they keep calling and saying, are we good for the end of the year? Do I need to start saving up for next year? Am I going to lose my voucher next year? And we're like, no, we're good for 2025, 2026. So I think those are the two major issues that I would address.
Thank you. Appreciate that. Thank you. Yes.
I think one of the questions I would ask official is, how do you build trust with a community that does not trust you? I think that's the overall arching. How do you build trust with it? I mean, you come to this community when you want their vote or when you need something, but you don't come to this community when they need something. So how do you build that trust?
That's a good question. That's a great question. Roxanne?
I need the systems to talk to each other, because a lot of times we see issues that are interconnected. So the clients that I see have mental illness, they have substance use disorder, they have sexual health issues. So when I was funded under DHSP, it was difficult to talk to folks that were in mental health and under SUD. It's gotten a little bit easier, but that's a teaspoon when it needs to be an ocean. We need the systems to talk to each other, because oftentimes us HIV and STI people, we talk to each other, but we don't get a chance to talk and work with and collaborate with. We need to be in the rooms with each other a lot more so that we can actually make the things that we're doing work together, because we're all seeing the same clients.
And I think that's basically, you're saying, improve the holistic care model. Because we talk about holistic care, we focus so much on a person's HIV status, we ignore their mental health, their physical health, their spiritual health. We ignore all of that. Just take your med. Take your med. Although you are, about to have a whole crash out, at least you're on your med, you're undetectable. So to have that kind of collaborative work is critical, and it is important to make sure that people are getting the full scope of services that they need. And oftentimes we come to events like this and we'll see all the tables, but we still don't talk to each other. And I think that we got to do a better job of networking. So I think I have like 2 more minutes. Let me see what else is on here. The questions that they gave me. Let me see. And I love you brought up Black women. Because I go to, and a lot of us here, we go to conferences all across the country all the time, and MSM is always talked about. You know what MSM means? See? Men who have sex with men. Do you know why we say MSM and why we say men who have sex with men? Because even though I am gay, I can identify as heterosexual because I'm only gay in the bedroom. So men who have sex with men. So I can identify as heterosexual, but I'm still engaging in same sex. So instead of trying to put people in a label box, say are you gay, are you bisexual? No, I'm straight. Okay, but behind that door, doing the survey, everything you're doing on your risk assessment shows that you are engaging in what people would say gay sex. So it's an easier way to put somebody in a category without categorizing them. So we say MSM. And I think that's why I made you say, what does HOPWA stand for? Because when we talk about community does not know our acronyms. They don't know our language, our jargon. We can sit in the same space and we can acronym you down. And you'll be sitting there with a blank stare like, I came to this whole workshop and have no idea what they said because everything was in letters. So that's why I want to clarify what MSM stands for. But you're right. We have to do, to me, a greater work when it comes to women's health. And just talking about women in this sexual health conversation, because there is still a major gap when it comes to ensuring that you're knowing how to navigate as a woman. And I can't do that. I'm not a woman, if y'all didn't notice. Y'all did notice I'm not a woman, right? Okay. I'm just saying, I'm not that gay. All right, so the last question. What is one specific action you believe must happen in the next 6 to 12 months to prevent further harm to our community? So this time next year, what is one specific action you believe must happen?
Right here.
Nope. We got these 3. Okay. And Kevin, you gonna say something?
Yes, good morning. My name is Omar. I believe in faith that we should emphasize changing our behavior and making permanent changes through faith. If we make the changes, then we eliminate a lot of problems, a lot of situations that will come out of our behavior, because it's our own individual behavior that disrupts the community. We can say it's a lot of things. We can say it's AIDS. We can say misunderstandings. We can say other people. We can say other people's wrong intentions. But it boils out all down to our behavior as an individual. If we change our behavior, then we can change our community, and our community can and will be better. Thank you.
I love that. Self-accountability. Self-accountability. I love it. And you are in control of your wellness. Wellness is your choice. Yes, ma'am.
Thank you. My name is Christiana. I work at Black AIDS Institute. This week has been a little full circle. So Monday, was it Monday we went to CDU? Monday we went to CDU, and then they showed a video of patients from the Oasis Clinic. I had a different perspective. So my great-grandfather is Ted Watkins, who was the first owner of the land where CDU stands today, where Martin Luther King stands today, where King Drew stands today. So it was a full circle to see the community still there, still thriving with what they have. So I think your question, it guided me because I wanted to bring him into this space today because I think it's so important to bring our ancestors and to see how far we've come. And I think the biggest thing that we can do from 6 to 12 months is to remain passionate of the cause. I know, like, going into this new year, I had colleagues of mine, they're like, oh, I'm scared, but I always had this, like, this is what these organizations are made out of. Like, when funding dissipates and then when people stop showing support, these organizations just grow and they thrive. So it's good to see that the organization that he started, the land that he literally plowed himself, is still standing and still creating beautiful stories and creating initiatives that are outstanding today, that we still have that same passion and we move forward 6 months, 12 months. It's just all about passion, honestly. So I think that's where we need to go.
I love that. Thank you. I think there was one more comment. Yes.
I would say if we can do 1 year from now, I think if we can have what Roxanne said, echo that, have our providers, our healthcare providers, our medical providers, our primary doctors talk to each other. I think when one goes to their HIV specialist and they go to get their medication and they have pain on their knee or pain on their leg or something, and their HIV specialist is like, okay, well, I'm not that. You need to go somewhere else. I think having the providers contact each other, like you mentioned, the holistic care approach needs to be improved. I think that could be done maybe in that year. Thank you.
Awesome. Thank you. Mario?
Thanks, Dante. 11 months from now, if we do not set a record for the number of people who vote in a non-presidential election, shame on all of us. That's the only way to stop the bleeding. There's a big gash. Stop the bleeding and then begin the rebuilding. All this damage in the last 10 months is reversible. But the leaders in Washington especially need to hear a loud, resounding message from people across the country. That's the way on top of the list.
Yes, 100%, 100%. Definitely. And then one more? You got one more?
Last one.
Okay. Okay, yeah. Oh, come on, Queen. Yeah.
You know, I have to say this. I believe in action. And I think the most important thing we can do is help the youth. Every year, they do for free the, it just slipped my mind, the Black College Expo. Why are we not there? Why are we not giving a book grant away for free to hear our seminar on preventive health sex? These are the future kids of America. These are the kids who are black and brown that are going to college. And where do we get sexually transmitted disease from? In college. That's when they first start having sex. We need to hit them right when they're on their way to college. You have the 10th, they start the 10th grade, 11th grade, and 12th graders are there. They register, and they register them. So we need to commit to going with the Black College. They do it every year in February, and they do it all around the whole United States. They don't just do it in California. They do it everywhere.
The Black College Expo.
That Black College Expo. That's where we need to be at. That right there set us above the rest.
So, Mario, we need funding for the Black College Expo tour. please, sir. Yeah, there you go. There you go. You are now on the committee. So in closing, thank you for all your responses and feedback. My one thing that I would love to see this time next year is a place like this filled with people. But I think it will only happen if we do it after hours. The people that need to be here are at work. It's a lot of people that would love to be a part of this conversation, but they have a 9 to 5 that they got to get to. And I know a lot of us are like, well, that means I got to work overtime, or well, how passionate are you? How invested are you that you can't just take, a few hours out of a year to come and really talk to the community? Because the room is filled. We only have 6 people who don't work in this field that's in this space. If we want to really get to the community, we got to work with them and their schedule. I love your input about the salons and the barbershop. Yes, you are 100% right, but where they at right now? Cutting hair and doing hair. They would be here if they didn't have to cut and make their money. So we can't disrupt the community's coin to say, come and talk about this. So we got to kind of find some kind of way to meet them where they're at, come when it's dark, serve them dinner instead of lunch, work around it, and then just really fill this space because we're right in the community, right in the perfect location to get them here. So next December, do this around 6 o'clock at night. Okay? You probably won't be the chair. But next year, let's just do it at night and get the community really here. So get it for Dr. Morrison one more time.
And Dr. Morrison. I'm going to pass it. I know she has to go. We have Shelley Jones from CDU, Charles University, Oasis Clinic. Give her a round of applause. Who is going to introduce a video we're about to watch. I'll give it to her.
Thank you, Dr. Maltzby. My name is Shelley Jones, and I'm here representing Charles R. Drew University and Drew Cares. And I want to start off by thanking the Black Caucus for inviting us here today. We're honored to be here and to be part of this event and to share a PSA that we created called Preparing Women, Raising Awareness Regarding Women in PrEP. A group of us came together. We found some gaps in access, in knowledge, and in education, and we created this video. It's 2.5 minutes long. 2 of the creators are here today, Tracy Bivens Davis and Roxanne Lewis. We, along with Dr. LaShonda Spencer, Susan Alvarado, Shelby Brown, and Ayako Miyashita Ochoa, had an all-hands-deck approach. We wrote the script, some of us. Some of us acted, had their debut acting. We were all volunteers. We all came together. Some of us recruited spouses to participate. Others helped produce and fund the project. So far, the feedback that we've received has been everyone in our community has really liked it. From the folks outside of our community, what we've heard, and we've had 210 hits or views as of Tuesday or Monday when it was released. We've had 210 views. But from people outside of our community, what we've heard is, I didn't know this was a thing. I didn't know PrEP was for women. And since it's a PrEP and women video, we've heard, is PrEP for men too? How come I've never heard of this? I wish I'd known more about PrEP because I may not be living with HIV now if I'd known more and understood the impact. So we want to hit 200. We want to hit 500 hits. By the end of the month, we have flyers that Tracy's going to pass around. I apologize for the typo on here. But please like it, share it, visit us on YouTube, leave a comment, share the link with others, and remember, as we all know, that PrEP is for women. PrEP offers more than just protection, it offers freedom. It puts the power of prevention directly in the hands of women, allowing them to take charge of their bodies, their health, and their future. In a world where not everyone has the ability to navigate safety, PrEP can be a life-changing line of defense. The power to prevent HIV is in our hands, and it's never been easier. Thank you. Now let's watch the video.